Welcome to AFMCTV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMCTV, thanks for watching. Have a great day. Welcome to AFMCTV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Chad Rodgers. He's Chief Medical Officer here at AFMC. Thanks so much, Dr. Rodgers, for being here.
Yeah, I'm glad to be here.
So we're talking about RSV, COVID, flu. As we head into this respiratory illness season, what are you seeing right now? Is there a lot of flu? Are these things happening?
There is a lot of flu currently. Certainly every year we see each one of those viruses have their own sort of seasonal variation. So it's kind of hard to know which is coming first. Right now we're kind of at the height of the flu. You still see a little bit of COVID here and there and starting to see a little bit more RSV. But flu is really the primary virus that we seem to be dealing with currently.
And what is important for healthcare providers and community leaders to continue paying close attention to all three of these viruses rather than focusing on one, or should it just be flu right now?
Right. No, I think it's important to pay attention to all three. You know, it's one of those things where there's always one that's sort of kind of at the forefront, and then like flu starts to taper off and COVID starts to pick up. And then usually sometimes we see one or two peaks of RSV and even sometimes a second peak of flu each year. So, you know, it's real important to follow those patterns. It kind of lets you know what's in the community. It can also help, you know, prevention efforts, you know, really trying when people start having cold and flu, kind of cracking down, encouraging people to stay home, to not come to school, to go to the doctor and get tested so that they don't spread it to others. But they rarely ever come all at once, it seems. So there seems to be always something going around, but it's just sort of the patterns of when they do come. And then it's sometimes hard to know, differentiate one from the other. So that's also an ongoing challenge.
So from a parent's perspective, what are the most important signs and symptoms to watch for in children this season?
Yeah. So I think the biggest thing that kind of, especially in Arkansas where we have so much allergies, people often have congestion and cold. I think the big sign that most people kind of relate to the flu and to COVID is fever. So fever is kind of the big thing. You don't get fever as much with allergies or asthma unless you're developing some sort of other infection. But you're certainly the height of a fever that comes on suddenly and fast is really kind of a hallmark symptom for the flu. COVID seems to kind of take on multiple different forms. Sometimes people start with a sore throat. Some people have started with congestion. Some people with a loss of smell. So it kind of always has a little bit of different presentation. Sometimes the only way to know is to test. And then RSV, it's just kind of a really annoying, difficult cold. For the younger the child, the more difficult it is. But congestion being kind of the big symptom. Of course, again, we have allergies and then we have daycares. You get lots of colds. But it's usually really kind of just profuse, runny, bad congestion with a very characteristic kind of harsh kind of staccato cough that people describe.
And many parents struggle to know when to manage symptoms at home versus to seek medical care. What guidance would you give them?
Yeah, it kind of really depends on the age of the child. So the younger the child, the more likely, or the lower threshold you should probably keep to call your medical provider or take them in for evaluation, especially if your child has some other, medical illness. So if you have even if you have an older child with asthma or some other illness or chronic condition that kind of compromises their respiratory system or their ability to cough up secretions, those may kind of warrant going a little bit sooner. But there's a lot of resources in order to kind of know when you should go to the doctor. Usually an older child, you can wait a few days if they seem to act well when their fever's down and they're drinking and eating, because most viruses are just going to take care of themselves. There are some things like symptom check finders, like the American Academy of Pediatrics has available to people. Most clinics in Arkansas have an after-hours call line where you can call and talk to a nurse. No one's ever going to fault you for calling or seeking medical care because, especially when your gut tells you that something may be wrong, I think that's worth checking out. But there are a lot of resources that you can have where you could talk to a nurse or you could do a symptom factor check, the fact check before you seek that additional medical care. It may prevent an emergency room visit.
And are there particular age groups or children with certain health conditions who are at higher risk for complications that parents and health providers should be especially mindful of?
Yeah, when I think about sort of things that would concern me more, like anybody who was maybe born prematurely in that year, so it's particularly a really premature baby, like less than 34, 32 weeks, those babies are a little bit more vulnerable for getting ill, especially with things like RSV. For children who have asthma, that's a big problem because they're sort of the normal way your lungs react. They kind of overreact, and sometimes that makes it more difficult to clear secretions, maybe makes it harder to get good oxygenation. I think kids, of course, with big chronic medical conditions like cystic fibrosis, those obviously you would keep a really low threshold. But anything that kind of compromises the respiratory system or your immune system, so if you're on chemotherapy or something like that, you may want to seek help sooner.
Vaccines and prevention continue to be key. What should parents understand about flu and COVID vaccinations this year, and what other preventive steps really make a difference?
Yeah, so it's definitely vaccination is the key to kind of help, maybe not preventing you from completely getting the illness, but helping build your immune system so that if you do get the virus, you'll be able to fight it better and you're less likely to get hospitalized or more sick. So those are really the goals of vaccination. Also can help reduce the spread. But there are vaccines available. I think everybody has the traditional flu shot and would really encourage people to talk to their provider about a flu shot or go to their local pharmacy where they can get a flu or health department. The COVID vaccine still remains available, and you see that it is available to kids 6 months and up. There is a current recommendation to discuss that with your primary care provider, and that maybe parents might want to vaccinate based more on risk, although other organizations like the American Academy of Pediatrics are recommending going ahead and getting vaccinated to protect others. You also never know who is going to get really sick. The other thing that's been really helpful is RSV is a vaccination. It's not a traditional vaccination in a lot of sense, that it gives young children protection. It gives them antibodies to protect them against the severity of respiratory RSV, the respiratory syncytial virus. And what we saw last season is there was a huge reduction in the number of children who were hospitalized as a result of that vaccination. So definitely would talk to your provider about if your child qualifies. If you have a chronic medical condition, if you're an older adult, definitely would think about getting those vaccinations. The other exciting thing about RSV, I'll just throw this in, is that there isn't a vaccination for older adults. We used to not think that was a big deal for older adults, but it really, there is something that's available for adults that are 75 or older, or if you're 50 years and have other medical conditions, you would qualify to get an RSV shot. It's a one shot that will protect you against this virus. It could make sick babies really sick, but it can make adults really sick too. It's also just a respiratory virus you don't want to have to really deal with. There are other things that would qualify for people for getting that vaccination, so you can talk to your doctor about that and get their advice and make a shared decision about getting vaccinated to protect yourself this season.
Is it too late, or when is too late?
It is never too late. So we do encourage people to kind of start getting their flu shot and the COVID vaccination kind of every year before the season begins, because that's really once you have got the virus, the vaccination is probably not going to help that much. But if you can get it beforehand, although if it's several months into the season, you haven't had the flu yet or you haven't had COVID yet, certainly going ahead and getting it. We do booster a lot of times your immune system with those annual shots, but this still gives you some protection throughout the year. So it's worth getting the shot if it's available at any time of the year.
So what trends or red flags should they be watching for healthcare providers that should be watching for with flu, RSV, and COVID circulate at the same time?
Yeah. So sometimes when you get a virus, of course, you get sick, you get congested, your energy gets down, you don't feel good. So getting another virus on top of that can obviously weaken your immune system and make you more vulnerable. And so sometimes we call about like the double whammies, like you got one virus and you got another. And sometimes we'll test for the viruses and we'll have people who are positive for more than one, which may be an issue with testing, but a lot of times it is possible to have two.
Is that rare?
It is rare, but it does happen, and especially when you're in the season. I think the big thing to remember is, these are viruses. Most people are going to do well. You kind of do your, Tylenol, Motrin, keep the fluids going, get lots of rest, try to stay home and prevent the spread. But if you're getting well and you're improving from those viruses and then get acutely worse again, like you start having fever again, or your cough picks up, or your symptoms are getting worse, then I would definitely consider evaluation, because what we really worry about, things like with flu and COVID, is the pneumonias that sometimes follow. And that could be a very catastrophic event for a lot of people. So,
how important is clear communication with families right now, especially with symptoms overlap and guidance may feel confusing?
Yeah, it can be very confusing. I think, having that trusted healthcare provider that takes care of you and your family, or even knowing their nurses and having that relationship established, that you can call their office and discuss, and also ask for resources that they recommend that you might go to read more, to find out more, are really important. There is a lot of confusing information out there, so you really want to make sure you're going maybe to the state health department for information. You're going to like the American Academy of Pediatrics or the American Academy of Family Practice, organizations that kind of deal with healthcare providers who kind of commonly see those. They have lots of resources on their websites to help people get good information.
So how can healthcare organizations, schools, community partners work together to reduce the spread and protect vulnerable populations? Is it all about hand washing?
Hand washing is very important. So certainly we know that the spread of viruses often occurs when you touch something and then you touch your nose, your eyes, your mouth. And so good hand washing or having some hand sanitizer is really important. Probably if you are ill and you're not sure what you have, masking is still a good idea until you can get tested or get evaluated to make sure that you're not spreading. And then anything that encourages vaccination is going to help prevent the further spread of and sort of the illness associated with all these viruses. And
you touched on these a little bit, but one last question about finding reliable, safe information, not only for healthcare providers, but for the community.
Right.
Where should they go?
Right. So I think, if you look at the American Academy of Pediatrics, it sort of has most pediatricians, or the American Academy of Family Practice, or American College of Physicians. Those are all primary care organizations that deal with these a lot. They all have really good, friendly patient handouts. If you are also, our AFMC website has some information available where to go to get good healthcare information. But I would just be very careful. There are other hospitals and there are other medical organizations that you can look. Just make sure that it's sort of an accredited, well-known organization that you're looking for, and not just some mom and pop shop, because you could get some bad information that could result in some bad results.
I would think social media would also be a hard place to start, not so much a good place to start.
I struggle, like in TikTok, I think there is a lot of information out there, but again, if it's linked with somebody who is representing like those organizations, you can feel better, as opposed to sometimes, probably if you hear it in one place, it's not that good of information. But if you're able to go to several reliable sources and get the same answer to the same question, I think your likelihood of getting bad information goes way down.
Good advice.
Yeah.
Well, Dr. Rodgers, thank you so much for being here today.
Yeah.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.